Prostate is a small gland, probably about 15 to 20 grams in size, and it's located just under the bladder, in front of the rectum, and it surrounds the urethra, which is that channel that leads urine from the bladder to the outside. Its main function is to assist with the ejaculate. It produces some of the semen. It's about 30% of what is ejaculated, and it contains some sperms. It also contains nutrients, sugar in the form of fructose, which supplies nutrients to the sperm. It also has zinc in it, and zinc also offers some protection to the sperm. And it has what we call an alkaline pH, meaning it's not acidic. And that alkaline pH is very helpful to the sperm because the medium in the vagina is acidic. So it neutralizes the acid in the vagina and gives the sperm a chance to survive for a longer period inside the vagina. So it does play a role in terms of the ejaculate and the protection and nutrient to the sperm. Well, it's not so strange because screening in recent time has become controversial. But people who are at risk should be screened for prostate cancer. And of course, only men have a prostate. So men who are over the age group of 50, because as you get older, there's an increased risk of prostate cancer. It's more common in blacks, so blacks should also be screened for prostate cancer. And definitely, if there's a family history of prostate cancer, then you should definitely be screened for prostate cancer. Options varies just like any other cancer, and it depends on at what stage the cancer has been diagnosed. So once a cancer is diagnosed, prostate cancer is similar in the sense that you stage the cancer. Is the cancer confined to the prostate? Has it gone beyond the prostate to adjacent tissues, or has it gone to distant sites? And the staging will determine the treatment. If the cancer is in the early stages, then treatment option is really surgery or radiotherapy. In the advanced stages, it's mainly the use of drugs, hormonal treatment or chemotherapy. So those are really, on a broad term, the treatment options for prostate cancer. Prostate cancer is, first of all, it's localized to the prostate, and the natural history is that it will grow and sometimes go beyond the confines of the prostate, extend up into the bladder or any tissue adjacent. But most commonly, it spreads to the bone. That's the most common site, especially the lower back and the thigh bones, the femur. Those are the areas that prostate can spread to, but it can also spread to obstruct the tubes draining the kidney, called the ureters. And these patients may end up with kidney failure. It may go to the spine, and these patients can end up with paralysis, becoming paraplegic, not able to move the lower limbs. It may spread to the liver, the lungs, the brain, other tissues. But that's how the cancer usually progresses.